Fabulous. Thanks.
No problem. So today we are going to go through introductions so you know who will be speaking to you, who we are. We're going to talk about provider portal registration. We're going to talk about provider portal sign-in. We're going to talk about the Qualitrack landing page. And like I said, those navigation tools. What does this system look like? How do you get around in it? What buttons do what? And we're going to talk about how you find and create a member. That's a very important first step to using Qualitrack. And then a little bit about the member hub, which is, I like to think the member's home, very much like in an EHR style, where you have a single page for the member and then you see everything for them there and you navigate from within that. And then we'll have a Q&A. We'll have time for Q&A, same thing as we did last week. And then we'll close with a summary, reminding us all what we're doing and why, and then a brief closing. So first off, so for presenters, today you're going to hear from me again. So my name is Jean McClurkin, for those of you who weren't here last week. I am the PASRR implementation for the clinical management of this. I've been leading the Telligent PASRR effort in Montana since 2019. I'm thrilled to come back to Colorado. This is my roots. I was a behavioral health provider for Arapahoe House for 10 years, worked in the community mental health space, worked at Denver Health Inpatient Psych for a while. I feel very comfortable with the resources in the Denver metro area that relate to PASRR and mental health support. And Stephanie, I'll let you introduce yourself since you're here too.
Hi everyone, I'm Stephanie Wilson. I was on the last week's presentation if you were on that. I'm the implementation specialist here at training here at Telligent. So my goal is to help make sure everyone knows how to use the Qualitrack system, how to get registered for it, and then provide you support after you're online.
Thanks.
So I will take it from there. So I'm going to start us off with a screenshot of the Colorado Long-Term Services and Support training page. Currently, this is where we have the link where you can register to get your portal account. And I think eventually we'll have this on the PASRR training page as well. But this link here will get you started so that you can go ahead and get registered. So when you land on this page, and I have the link up here for you to follow, you'll want to scroll down the page until you get towards the bottom, and you'll see a panel that says Telligent's Qualitrack Review and Provider Portal. And you'll click on that panel, and it will open up. And here you'll see our portal registration link where you can get to the online process to actually register for a portal account. And you'll also see that current official training guide. That training guide will also be emailed to each person that gets set up as an authorized official. So when we send the email with your username and the link to activate your account, we'll make sure that you have an additional copy of this training user guide. But we did want to get it posted on the webpage so people have it as a reference. We will continue to post additional information here, such as recordings of training, the slides, different things like that, along with having them on that PASRR training page as well. And then once the portal is live, we'll post that link so that you guys can access the portal whenever you need to, and that will be available on this page as well. So the provider portal registration is completed entirely online. We previously had a paper process, but with COVID and all the kinds of stuff that went with that, we moved it to this online process so that you don't have to worry about passing around paper, getting signatures, and then putting it through the mail. So you'll click on this provider portal registration link, and that's how you'll start that process. One thing to note, and you'll probably hear me say this a couple times as we move forward, but if you are going to have more than one authorized official at your organization, you'll complete it for the first authorized official, then you'll need to close that and come back, click this link again, and fill out the form a second time. And I'll kind of walk you through that and show you what it looks like. But just as a reminder, you will have to fill out this form multiple times for each authorized official at your organization. So when you click that link, it'll take you to this first page. And we talked about this a little bit in last week's training, but for anyone who wasn't there, there will need to be an executive a team lead, a manager, something like that will need to indicate who they want that authorized official to be. The authorized official will be in charge of setting up all the other user accounts at your organization. So the provider executive will enter their name and email address here in this provider executive section. And then they will indicate in this authorized official section who they want to be that authorized official. So they'll enter that person's name and email address. And then they'll click this begin signing button down at the bottom. From that process, once that begin signing button is clicked, the authorized official named in this section will receive an email with a link, and that link will allow them to complete their part of the registration process to get their account set up. Like I said, if you need multiple authorized officials, you'll enter the executive manager lead's name and this your name and your email, and then you'll indicate the authorized official, click begin signing, close the window, click the link, come back to this page, re-enter your information and who the second authorized official is, and then continue through that process till you have everyone that you want to be an authorized official indicated, and that email will be sent to them. So like I said, the complete process is all online. It's pretty much completed in 3 easy steps. That provider executive, management, team lead, whoever that is, will fill out that first part, indicate who they want the authorized official to be. The authorized official will receive an email with the link in it. They'll click that link, they'll go back into the system and they'll fill out their part, such as email address, phone number, different things like that. One thing to note, the form does ask that authorized official to enter the organization's NPI. If you do not have an NPI, please enter the Medicaid ID of your organization, and we'll use that to make sure we get your account set up. If we have any questions or any problems going through that process from that Medicaid ID or the NPI that you provide, we will reach out to you through email and make sure we have everything clarified and that we have you set up correctly. Sometimes people ask if that provider executive and the authorized official can be the same person. And there are some organizations based on your size or how you're set up that do want that provider executive and the authorized official to be the same. This process will work exactly as I've explained it. You'll just put your name in that provider executive area along with your email, and then you'll put that same information down below in the authorized official and click the begin signing. You'll then get the email and can fill out the rest of that authorized official information. Once all of that has been completed, so the executive has filled out the information, the authorized official has got their email and link and continued and filled out the rest of their process and form, that will all come back to Telegen. We'll get your account set up, and then we will send out an email to the authorized official letting them know what their username is. That email will contain that user guide and a link to activate their account and set up their password. Once you do that, your account is set up and you'll be able to access and start using the system. So just kind of to recap, all of this is completed online. We use DocuSign technology, and the documents are routed via email to the appropriate parties for each of their pieces of information that we need from them. Once everybody has completed their sections, both the person entered as the executive and the person entered as the authorized official will receive a copy of that fully executed agreement so they can keep it in their records. The Qualitrack team will complete that registration process and send that email to the authorized official with their user ID and that link to activate their account. And then that authorized official will have access to begin creating and managing all the other user accounts within the organization. So just a couple things to talk through. Once you complete that packet and get it back to us, we will begin creating those accounts, and we will start sending out those emails to the authorized officials the week of February 22nd. You may read in the packet, if you read through all the directions, that it takes 3 to 5 days to set up an account. That is correct, other than because this is the start of the contract and the system won't be available until March 1st. That activation email is only good for 7 days. And so we want to make sure that that's not no longer active when you go to set up your account. So we'll start sending out those emails the week of February 22nd, and then people will be able to follow that activation link and get their accounts set up. Another thing just to note, because of industry security standards, we do ask that everyone change their password every 90 days. So when you log into the system, you'll get a system message saying that you need to change your password. And I'll show you this in a little bit, how you'll go through that process, but you'll just click the reset password link on the login page, and you'll be able to reset your password. Again, just so everyone.
So sorry to interrupt. This is Jennifer Chapton at Porter. I'm sorry, I was on a call previously. So the portal registration, how do we start that, like with the manager, or is that going to be sent to us at some point?
No, it's actually on the website. So if you go, I will send these out, but if you go to that link, the website, and scroll down to this panel that says Intelligence, Qualitrack Review, and Provider Portal, and then click on that, it'll open up, and this Provider Portal registration link will be there.
Thank you. I'm so sorry.
No, that's fine, Jennifer. We're going to have time at the end for a Q&A. So if you've got questions, put them in the chat feature. I'm monitoring that while Stephanie's presenting, and then we'll take care of all the questions at the end.
Oh, perfect. Thank you.
Yeah, just because we have 150 people on the line. So if people start unmuting and asking questions, we might not get through our content. So I just want to make sure everybody has a chance.
Yep. No, good question. Again, the Qualitrack system actually won't be available until March 1st. So we just want to make sure everyone's aware of that. And you'll probably hear me say it a couple times as we go through all of this, but that's just available in there. Again, I put the link to the website so that you have that available in a couple different places. And please continue to monitor this website and the PASRR training website, because if anything new information gets added, those recordings get added, that's where they'll be. And we want to make sure you guys have access to that information as soon as we get it out there. So we do have just some basic information. Again, we have the link. That provider portal registration link is used to actually set up your authorized officials. And then we have that training guide there. Another thing we just want to make you aware of, and again, it won't be available until March 1st, but we want you to have the phone number. This is to the Qualitrack or Intelligent Help Desk. So if you have any problems with getting logged in the first day that it becomes available or something like that, that help desk number is there, and people will be able to help you. You may have my email, and I can post it again if you need it, but if you have trouble with the registration packet, feel free to email me. I'm happy to answer those questions and make sure you get through that process as quickly and easily as possible. So that was kind of our deep dive into how you get registered for the portal and what needs filled out and how that process goes. So now I'm going to introduce you to what the Qualitrack portal looks like. So like Jean said earlier, you can get a feel for how that's laid out, what the process is there, and everything that needs to happen. So once you get your authorized user account set up and you have your username and your password is available, if you've had any other users, you've gotten those set up, and you go and actually log into the portal. This is what the home or the landing page looks like for Qualitrack. So you'll notice we have a care management box, a utilization management box, and then we have a bar up here across the top. And we're going to walk through this bar and the utilization management box. This care management box is here because we do have some users that provide what we call health management. So they do disease management or health coaching and things like that. So that's why that box is there. But we're going to really focus on this top portion and then this utilization management box, because that's what all of you will be using our system for. So the bar across the top, we call it our provider portal menu bar. When we talk real fancy, I just call it the bar across the top so that everybody can see what's there. This bar will be available wherever you are in the system. So no matter what page you're on, and we'll kind of walk through a little bit of that, but you'll always have access to this bar and these icons across the top. So you'll notice our Qualitrack logo over here on the top left. If you click that logo, it will take you back to our home page. So this page, so no matter where you are in the system, if you're like, oh, I got somewhere I didn't need to be, I want to go back to the beginning, you can always just click on the Qualitrack logo. It'll take you back to the home page and you can start over with what you're doing. The magnifying glass over here is our search feature. So if you click on that, you'll have the option to search for a member or the option to search for a case or a review. And we'll walk through that member search in a minute. But you can get to that magnifying glass icon again at any time. Click on that and it'll take you to our search features so that you can find another person or find a specific review or case that you're looking for. This little 3-bar icon is our task icon and will take you to our task queue. You guys won't see a lot of tasks, but if there's ever a request for additional information, so if you submit a review through the system and they're like, oh, we need this additional clinical documentation, or we need a medication list or something like that, the reviewers that are going through that will look through the information that you've submitted and they'll say, oh, I need this medication list. So they'll send that back to you to attach that medication list with official language that tells you exactly what they need. And at that time, you'll see a task in the task queue that says request for information. So that's when you'll use that task queue and see things in there. The next one, the circle with the question mark, is what's called our Knowledge Center. And so we'll put user guides, FAQs for the system, if there's any tip sheets. So if a new feature comes in the system that we think you guys maybe want to use and may need some direction on how to use that, we'll put that out there on a tip sheet, and then those will be available to you anytime you're in the system and have a question or different things like that. The actual presentations that we're doing won't be posted out in there, but those user guides and tip sheets and things like that will. And then the last icon on here, the circle with the kind of person looking thing in it, is your My Profile. This is where you can go if you need to make a change to your address, your phone number. Maybe you've recently gotten married and your last name has changed, something like that. You can go into that My Profile page and you can enter that information. And this is access to anyone. You don't have to be an authorized official to update your information once it's in there. Anyone that has access to the system and has an account will be able to go to their My Profile page and make those updates. The only thing you're not able to make changes to is the username that's assigned to you. Once that username is assigned, it has to remain unique and identifiable, so that is not able to be changed. But all the other data on there, you're able to access it and create updates to it. Also, if you click on the little arrow next to that icon, that's where you can log out of the system. You'll see the log off text and you can click that and log out. So that's our top portal bar. Again, we have that magnifying glass, and here in the utilization management box, we have this search right here. Both of those do the same thing. So that's how you can go and do a member search or a review search and start that process. We're going to walk you through how to search for a member, because that's really how you'll always start a review in the system. You'll go to that search functionality, you'll do a member search, and then we'll start everything there. So we'll click search. It'll take us to our member search page. And once we land on that page, we have 2 ways to find a member in the system. So you can either search using member ID and date of birth, or you can search using member first name, last name, and date of birth. So we'll kind of walk through each of those. So again, for the member ID and date of birth, you'll enter that member's Medicaid ID and their date of birth, and then you'll click on the search button. One thing to be aware of is we'll get a monthly load of Medicaid members from the state, and we'll load that into the system. So you'll be able to search against that data that we load. But when you search, this information has to match exactly. So you can't just start the first 3 numbers of the member ID and then put a year and the date of birth and click search. The system won't return any results to you with that. It has to be ensured that you know exactly who you're looking for. So we need that full member ID and that full date of birth. And then when you click the search, if there's an exact match on the data that you've entered, then we'll return a result to you. So if you click search and you don't get a result, please always check. I know sometimes date of birth, year maybe is in front of month, or month is in front of day, or things like that. So there's always a chance to enter some of that information correctly. So please just validate that the numbers that you've entered are correct, and then click that search button. The same thing works with first name, last name, and date of birth. Again, we'll have to have that exact match. So enter the full first name, full last name, and that date of birth, and click the search button. And if it matches, it'll return those results. If it doesn't match, it'll let you know that, and then you can check to make sure you have everything entered correctly. If you receive a result, it'll display it down below, and you'll see their member ID, their name, date of birth. This information is listed there. And then any of these blue data points you can click on, so you can go ahead and access that member's information and start that review submission process. If you enter all your information and it tells you that there's not a member found, and you check it and you make sure that you have everything correct, and you still receive this member not found, that's okay. There are times when we will not have that member loaded from the state. And so you'll want to go through the process of creating that member in the system that you can go ahead and submit that review for them. And this happens in PASRR, especially because not everybody that you're submitting a PASRR for may be a Medicaid individual. So it's normal, we expect that to happen, and that's why this is here. So you'll see this member not found, try searching again, or add member. And we can click on this add member button. When we do that, it opens up our add member screen. And this is where you can enter the information that you have available for that member. One thing to note, anytime you're using our QualiTrack system, if information is required, you will see this little red asterisk next to it. So anywhere there's a little red asterisk, that means that we have to have information entered in that field for the system to be able to do what you're asking it to do. So you'll go through first name, last name, birth date, gender, enter that information. We do have social security number and member ID both required here. We do have to have one of them. We can't have both of them blank. But if you enter their social security number and they're not a Medicaid member, so you're not going to have a member ID for them, you can click the checkbox right next to the NA, and then we can go ahead and process that, this creation of a new member. Then we ask for their address. Once you have all of that information, you'll click the green submit button, and the system will create that member so that you can go through the process of submitting a review for them. So once you've either selected the member from your search results or you've created that member, we'll take you to what's called our member hub. QualiTrack is a very member-centric platform. So any information for that member that your user has clearance to see and view will be visible on the member hub. So you'll get to see their name, their member ID. You can also see additional information like gender, maybe their coverage lines, different things like that. But all of that will be available here in this member hub. And that's also where you start the process for creating a review. And Jean is going to go over from everything here forward for the PASRR level 1 and next week's training. Like I said, we just wanted to kind of get you introduced to things, but you'll see down here on this utilization management panel, there's an add button, and you would click that add button to start that PASRR 1 submission. So that concludes everything that I wanted to walk us through. It looks like we have quite a few questions. Jean, do you want to start us off on that?
Yes, ma'am. We have a lot of really good questions. All right, I'm going to go back up to the top and just read them as I go. Some of them are duplicative, so which is good, That means everybody is kind of on the same page. So we'll try to hit everything. So the link to I believe there are two really helpful links here. One link that we shared last week and we'll again share today is the link to the senior long-term care page. That's where QualiTrack will live, right? That's where QualiTrack lives. So that's where the portal registration packet, the authorized official. So we'll make sure to put that link in the chat for folks. And then the second website that's really helpful is the state's PASRR website. So the state's PASRR website is where we're going to be putting all of our training information once that's up and posted. So people will be able to see these videos, see these slide decks. We want to make sure that 100% of the content we provide to you is available for you to be able to download, digest, talk amongst yourselves, and then come to us with even more questions. So those links, we'll make sure we get both of those important links out to you. And then someone says, I missed the first meeting and can't find the recording of that. Can you post a link? Yep. As soon as that gets uploaded, I know it's going through the state right now. Obi, I'm not sure if you can talk about an ETA for when all that content from last week is going to be available. I think that'll help us have a good idea of when the content from today will be available as well.
The content from last week should be available before end of this week. That's what we're planning on.
It's a little hard to hear you. Before the end of this week, is that what I heard?
Before the end of this week.
Before the end of this week, okay. And then I will look into ways that we can kind of just e-blast all the people that attended this training and last week's training. I have the names of all the folks that accepted the training, and we could just send you saying, it's ready now, so that you don't have to check it every single day. We'll try to do something like that too, to notify you of when that gets posted. But anticipate by end of day Friday. So yeah, recordings from last week that have been posted yet. We just covered that. Good. All right. This is a great question. Emily Fox. We have this Stephanie. So this is for you too. We have 3 hospitals in our system. Will we need to do this process for each individual hospital? And I believe that that's all connected to the NPI number. So if your 3 hospitals in your system have the same NPI number, Emily, or if they each have different NPI numbers, I might ask you to unmute for a second, Emily Fox, and provide us that, because I think that'll help Stephanie answer the question.
Sure. Thank you so much.
Yeah.
So I believe we do have separate NPI numbers. I was just kind of thinking back to the previous system where we had to have an authorized user, 1 for each of our 3 facilities. And so I just didn't know if it was going to be similar to that system, if it would be, we can have 1 authorized user and be able to create accounts for all 3 facilities, or if it would have to be individualized again, if that makes sense.
Yep, it does make complete sense, and that's a good question. So it really depends on how you guys want to handle it. If you want to set up 1 authorized official, and then they provide us with all 3 organization NPIs, they can be the owner of all 3 of those. If you guys would prefer to have them separate, then you could have a different authorized official for each one. But it's really up to you. So when that authorized official receives the email and the link, they'll go through and enter, like I said, their name, their email address, business address, that kind of stuff. And then there's a form or a line on the form for them to enter their NPIs or Medicaid IDs. If they have NPIs, we would prefer those, but she can put every organization's NPI on that line, and then we'll just give her that access when we set it up, and then she can set up those users for all of those NPIs, or she could even set up users just and just give them one of the NPIs that she has access to. So it's really how you guys want that work to flow, but you don't have to have an individual one for each NPI. It can be 1 person over all of them.
That's fantastic. Thank you so much. That's going to be much easier for at least us. So yeah. Thank you.
Good.
Thanks for the question, Emily. It was a good question. We have a couple others in here that are about getting copies of the PowerPoint, copies of the recording. Again, we'll make sure all those links are posted to you. I want you to have these copies so you can look at them at your own time. I know I never learned things the first time. I need to see it again and again. So we want you to have that same experience. I'm going to jump down to Mary's comment, which is another great one. Will the provider executive also be able to enter level 1 reviews, or do they need to be set up as an authorized official? So Stephanie, I'll turn that over to you to see if I think both the provider executive and the authorized official have to do anything else to be able to do reviews.
So in the process, the provider executive just indicates who they want that authorized official to be. That authorized official can set up an account for whoever that executive is so that they can submit reviews, or that executive could also say that they want to be an authorized official. But putting your name and email in as the authorized official will not give you an account to submit reviews. So that authorized official will need to set you up as a user in the system, and then you'll be able to have access and view everything.
Mm-hmm. I think that's really important because we do have these 3 levels, right? We have provider executive at the top, authorized official in the middle, and then users at the bottom. And you've kind of got a pathway to get to each. So the provider executive is the only one that can create an authorized official, and the authorized official is the only one that can create the users. So that authorized official would have to create a user account for the provider executive. Is that a fair way to summarize it too, Stephanie?
Absolutely, yes, thanks.
All right, I want to jump down to the next question. Yep, and right there it said the executive will need to set themselves up as an authorized official if they want to manage accounts. That is correct. Obi added the link and his link in here that says colorado.gov/HCPF/long-term services and supports training. That's that website for QualiTrack, for the provider guide, for the portal registration, for QualiTrack. Then we have the PASRR website. That's for all your good PASRR trainings. So that really will be the difference between the two. So he put the link in here for where the QualiTrack stuff's going to be. And then Brittany asked, on the user agreement for QualiTrack, what states should we request access to when we serve multiple states? That's a great question, Brittany. I might need you to clarify that a little bit, unless Stephanie, do you have that one?
I do.
Okay.
So you'll just want to enter Colorado in there. You may serve members that come from other states and things like that, but this is really focused on Colorado and getting access to that data, that membership list, that provider list, submit those reviews so they come into our Colorado review staff to review and everything there. So for this registration process that you're submitting, just indicate Colorado in that spot.
Thanks.
Thank
Brittany,
you.
I hope that answers. Oh, go ahead.
Sorry, I have an additional question to tag on to that.
Sure.
So does that change how we're doing PASRRs related if we're only getting access to Colorado patient data? Are we only doing PASRRs then on Colorado Medicaid patients, or are we still doing PASRRs? How would we, if we have a patient from, let's say, Utah?
Yeah.
Coming into a facility and we need to do a PASRR on it, but we don't have the data?
Yeah. And that's, I think, where we have this great add member feature, because the only members that will come up in the system when you search are going to be ones that we imported from a daily.
I'll tell you from my iPhone 303-506-9338.
I want to mute that person real quick. Sorry, whoever I just muted. But Brittany, to answer your question, so for PASRR, having Medicaid is not a requirement for the member to get PASRR, right? We all know it's about the nursing facility being licensed to accept Medicaid members. So we have an add feature so that you will be able to search for any member we've loaded, which we are loading Colorado Medicaid files daily. But if that member is a Utah Medicaid or Blue Cross Blue Shield or private pay, you're going to have to add them. So we have that ability to add them for that reason. Does that help, Brittany?
Thank you.
Okay. Next question we have is from Phyllis Burton. If I am the authorized official, do I need to complete forms for all case managers, social workers? And I believe you mean for all users, for all people that could be submitting a PASRR, as this is a very large number to complete. And for some large hospital systems, I do imagine that to be a very large number. Stephanie, can you take that one?
Yeah. So you only need to complete the authorized official for whoever you want that authorized official to be. If you want there to be more than one, then you would have to complete that form for each person that you want to be an authorized official. We need at least one so that they can manage all of those user accounts. So anyone at your organization that you want to be able to log into the QualiTrack portal and either submit a review, update information on a review, or figure out or look at that outcome information, that person would need to have a user account. So once the authorized official is set up, they'll log into Qualitrack. They'll have an extra little settings icon up at the top next to that magnifying glass icon that I showed you on the slide, and it will allow them to manage users. So then they'll go in and they'll set up all of the users for your organization that need access to Qualitrack. So that you won't need to fill out that authorized official form. That authorized official will just go in and set up each of those user accounts. So they'll fill in that person's name, they'll assign them a username, and then they'll enter, we need address and phone number. Those are required fields in there, and an email address. And then they'll just click submit, and that user account will be created, and that they'll have to share that username that they created for that user with them through email or phone or whatever's easier. But then that user will be able to set up their password and start using the system. So we just need at least one authorized official for each organization to set up those user accounts, and then you guys can manage how many people actually need to be a user and have access to the system.
Yeah, I think, Stephanie, I think if I can paraphrase, I think Phyllis's question is more about how creating all those users. I think for her, she'll be the one authorized official, but then she's going to have a ton of users, just because a lot of social workers, depending on who's working the shift, who's working the floor, this could be quite a large number. So are there any shortcuts for how they create the accounts? Or can you talk about how extensive the process is to complete an account? Like how many minutes it would take you per account you'd created?
It probably takes 2 minutes. So you'll enter the person's first and last name. You'll assign them a username that does have to be unique. You'll enter their email address, an address, which is usually just the organization address, and then a phone number, and click submit, and then email them whatever that username that you assign them, so they have that and are able to set up their password. The system will send them an email based on the email address that you entered on their account with the activation link.
Okay.
So honestly, it takes less than 2 minutes to set up an account. The only thing you may have any issues with is, like my name is Stephanie Wilson. So a lot of times my username for something is S Wilson, which can be very generic. So if it's something like that and somebody already has the username S Wilson in the system, it'll force you to put like a 1 behind it or a 2 behind it or something like that, because those usernames have to be unique. But it'll give you a message letting you know that that username has already been taken and to use something different for that person.
So shiny unicorn rainbow number 4, probably a good one, right?
Yes.
Okay.
Yeah.
Sorry. Go ahead.
But yeah, it's a pretty quick process. It doesn't take very long at all.
I think someone was trying to talk off mute and I talked over you. I apologize. Want to try again? Okay. Okay. I'm going to go back to questions. If somebody did have a question, put it in the chat or just go off mute again and let me know. So next question I see here is, I am the only one that does this for Middle Park Health. So I will also be the authorized person to add others if we have more than one. Yes. So hopefully we just covered that question as well. Last one was my takeaway from last Tuesday's meeting was that level 2 PASRR would take 5 to 10 business days. Yeah, this is a long time to maintain patients in the hospital. Will that really be the case? We're shooting for as quick as possible. We just have up to that time frame. We do believe that this has to be done quickly. So as long as we get partnership and helping to get these scheduled, as soon as we get it submitted and we're reviewing the level 1, we'll be on the phone with you about scheduling a level 2. So a lot of it just comes from that. Our turnaround times also gives us the ability to get you back the assessment soon, hopefully the next business day or a business day or 2 after that, once it's been reviewed by the people it needs to be reviewed by. We do believe in having that PASRR completed before nursing home admission. That's the goal of PASRR, so that that member gets set up at the nursing home in the best possible way to know what the treatment plan needs are going to be unique to their PASRR condition. So we do want to take time for that. That being said, when you send the level 1, doesn't have to be the day they're ready to go. Doesn't have to be the day they're ready to leave to the nursing home. Feel free to submit that level 1 as soon as you have an identification that a member is going to a nursing home. We do have the ability to adjust the facility after the fact or during the PASRR process. So if you don't have a bed date yet for the nursing home that's been identified, or you're kind of deciding between two, we really wanted to build in that flexibility to let you guys start the PASRR level 1 process before the discharge day, so that does have time to be able to play out and let us get the level 2 done, so that the nursing home knows the treatment plan recommendations. And we've been able to kind of weigh in on the best level of care for the member specific to that PASRR disability. So hopefully that helped, Jan, add some context there. And Barton, I think we did have some folks that had some difficult time getting on this meeting. I will work to resolve that for the next meeting we have next week. These were set up as a schedule of Zoom meetings. So it was set up as a reoccurring meeting. And I did hear from folks that there was some issues, getting in. At first it said that this meeting was only supposed to be February 9th, but nope. We set it up to be recurring. So there are 3 of these meetings, today being the second one. I will make sure that whatever we can do to help avoid that message for next week, we will do. Worst case scenario, I will resend out a Zoom link for folks, but I'm hoping we don't have to do that because all of this information about the Zoom link, the password has already been out there and established. So we'll work to correct that on our side. Next question from Emily. This is another good one. Thank you, Emily. If someone forgets their password, Stephanie, can the authorized user reset it for them, or will they need Telligent assistance for that?
Actually, they just can reset it themselves. So they'll go to that login screen where you go to log into the system every time you go to access it. And right below where you click the sign in button, there's a reset password link. So you just click that reset password link, you enter your username, it sends an email to the email that is associated to that username and with the link in it to reset your password. And it's an immediate, you don't have to wait for it or anything like that. So as soon as you click reset link, enter your username and click submit, that password comes directly to you. Click the link, set up your new password, and you're back in the system.
Thanks. Next one, I think we also covered from Allison, what happens if the Medicaid patient is not loaded into Telligent? Again, we'll get that daily file from the Medicaid eligibility file. So if a person's ever had Colorado Medicaid, they are on that file, even if it's not active Medicaid. So we do have a very wide pool of members, but for all those folks that don't have Medicaid as an insurance, then you will be able to add them to our system. So hopefully that helps there. Oh, and then this is a nice follow-up. Can we submit PASRR for Medicaid pending patients? Same thing. And I think this also blends well with another question down, which is, can records be merged into the same member once we notice that on the back end? And again, Stephanie did talk about really wanting to make sure that you search. Hold on, I have a cough. Excuse me, I'm talking too much. And it's really dry out here in Iowa. You really want to make sure you do a good search for that member. But I want to know, Stephanie, if you can weigh in about the merge aspects.
So yes, our system does check to ensure that there's enough matching data points, and then we will merge those on the back end if we can do it. If for whatever reason, maybe the Medicaid ID or the Social Security number or something like that gets entered incorrectly and we can't make that match, you can always notify us that you think there's more than one person in there that's the same person, and then we can go through a manual process to get those merged together.
Thank you, Stephanie. I also think that's a really important point to mention for the sense of data integrity and confidentiality. We want to make sure it is the same person and it's not just someone with a nickname or someone with a very similar birth date. So we do a lot of work before we merge records, but we do have the ability to do it. So I think that's important to talk about. Is this training also focusing on changing our utilization review process? No, we are not touching utilization review processes for these series of PASRR stakeholder trainings. We are 100% talking about for PASRR. PASRR in Qualitrack just happens to live in the utilization management kind of window of Qualitrack. It's just where it lives. It's just its house, but it's renting the house, if you think of it that way. It doesn't live there. It doesn't own the house. It's renting it. It's got a room in the attic. We're leveraging that existing house rather than having rebuilt a new one. And we've just added on another floor to it. And then our EHR only gives the last 4 digits of the social security number. Will that work? No, you need to have the whole social security number if you are going to use that. There is the NA option, so you don't need a social security number. You can use a member ID number instead. So just so that you know that. And there may be members that don't have a social security number too. So that you can avoid that step in this process. Oh, Emily, another great question. Is gender self-identified or biological? We'll leave that for you folks to determine, working with the member. I know our level 2 form's a little bit more culturally sensitive, but we are also dealing with older health systems too. So I will let you guys know that there is male, female. I don't know if we have, Stephanie, do we have other options in QualiTrack? We do. Oh, I'm gonna let you talk about that.
Yeah. I think it's just 3. It's male, female, or I don't want to say unknown. That's not the right word, but it's, if it doesn't fall into one of those 2 categories, there's an additional selection for you to make.
Okay. We do want to be sensitive for everybody.
Yes, absolutely. Yeah.
And Phyllis, I agree. It is sad we have to ask that question, but we do. It's important, and we're dealing with systems that are a little bit older, that our society is evolving. So we're getting there. We will get the 2 caught up. Are authorized officials able to submit level 1s? Hopefully we covered that earlier, in that if you create yourself as a user, the authorized official can then do that. But the authorized official would have to create their own user account.
No, the authorized official will be able to submit reviews. We do that when we set them up. So they have access for both. They'll have the additional ability to create other users, and they'll also be able to submit and view reviews. They don't have to create another account for themselves.
This is why Stephanie's here. She's the QualiTrack guru. But Stephanie, they do have to set one up for the provider executive, right? That person doesn't automatically get one. Okay. Not
Absolutely.
themselves, but provider, executive, and any other users authorized official creates.
Yes.
Okay. Do we do a PASRR just for Medicaid members? Or if they're not, can we add them? Yes, we talked about that. You can add them. Do we do PASRR on Medicare patients also? You do PASRRs on everybody. Same process for everybody. Is there any goal to increase database above Colorado Medicaid? I'm so sorry. Literally, I just swallowed something wrong. Of course, it happens when you're presenting. I'm not sure. Stephanie, is there any talk about getting additional eligibility files? Because usually we just stick with one Medicaid file. Yeah, I think we'll just be sticking with one Medicaid.
But do know, if someone creates a member with the, social security number that or the correct insurance ID or Medicaid ID, whatever you use to create that member, that person is then searchable. So not every organization will have to create that member if they touch them. So the number of individuals in the system will grow as those members get added. But no, we won't pull other states' files into our system.
Okay. That's actually a really good point, that once you've created it, it's there for everybody. So when you add a member, you truly add a member to our system. All right. Remind me of the dates when we will start doing PASRRs. 3/1. Well, actually, no, that's not true. OB, there's still the 1135 waiver. So I'll let OB cover the date that hospitals will begin doing level 1s.
Thanks, Jenny. So Julie, the effective date for requiring all PASRR for all PASRRR requirements to become effective will be April 22nd. April 22nd. The 1135 waiver expires April 21st, and by April 22nd, our requirements will be reinstated.
Okay. Thank you for the clarification. That was on last week's training too, so we're trying to be consistent. All right, so next up, we have someone asking about Denver Health. IT department manages portal access for all of our staff across the organization. So will IT be the administrator? You can really create whoever you want as that authorized official. If you want that to be someone in your IT department, great. They don't ever have to touch a review in the system. They can just manage accounts and get all of that set up. So that hopefully that helps there too. Can all staff see PASRRs for the organization? Yes, this is where that NPI comes in. So every time a user account gets created, you're being created under the umbrella of your organization's NPI, your organization's identifier. And then that way, whatever your organization gets attached to for a PASRR, so every PASRR that has your organization, you can see, even if you haven't touched it, even if you weren't the one that created it, you haven't ever logged into it, reviewed it, you would have access to it through the person's member hub. So that hopefully is a really great thing about visibility and how we create these accounts. So that should cover the next one too. Can all their coworkers see it? Yep. Has the beer list been updated? And I'm not sure, other than craft breweries in Colorado, what beer list you might be talking about. And are you able to get off mute real quick and let us know? Or somebody?
Jane, this is Shelley.
Hi, Shelley.
Hi. The beers list has not been updated with dosages since about 2009. So that's still the one that we're using for beers list limits.
Okay, great. See, this is why we have everybody. We have everybody in the call. Can the level 2s be done via telephone with the client? No. We really believe in face-to-face, but virtual. So we will set this up with Zoom, iPads, cell phones, computers, laptops, webcams, whatever can work for you. We have our scheduling department is very skilled at helping to set up these as telehealth interviews through a video chat. We would want to get state approval before doing anything over the phone, as that is not going to be our primary avenue of completing a PASRR. So we are going to be looking to try to get these via face-to-face virtually as to the maximum extent possible. All right, and then we have a little bit of a long one here. So that you can understand 5 to 10 days, wait, 2. We have a patient going to short-term rehab stay, nursing home who needs a PASRR. And we'll submit the PASRR as soon as we're aware of the recommendations to go to the rehab facility. However, the patient has to wait 1 to 2 calendar weeks. That can have a negative impact on the ability to recover, given lack of access to recommended level of therapy in a rehab facility setting. They also may end up rehabbing in the hospital. Okay, I might want to just talk to you, Melanie, a little bit more after this so I can pick your brain and try to hear what's going on for you and just be able to talk. I want to make sure I understand as we have 4 minutes left in this meeting and I've got 17 other questions. I am going to put a pause on that, Melanie, but I will reach out to you. My email content is in that first training that we did. I can post it here. Let me post my email for everybody. So feel free, we can follow up offline. Okay, so my email is there for everybody. And then, that's a long one. So the previous system did not allow for edits. From what I just learned, will we be able to edit PASRRs for facility med changes that have not started a new PASRR? Potentially, yes. I think once the level 1 gets submitted and is being reviewed, you're able to change the providers. But as far as the content and the answers you gave on the level 1 screen, getting those edited is technically possible, but we'll work to see how to do that, probably on a case-by-case basis as those come up. Really what you submit on the level 1 is what's going to be reviewed. So that's really important to get that content accurate the first time you send it in. But there are lots of things about this case that is editable in the future. Off of Leslie's question, if we edit a document, will the timeline for Telegen review start over? No. So the Telegen timeline with our RFI process, with requests for additional information, will stop our clock. So we have 6 business hours to review the level 1. If we have to send you a request for information, our timeline stops at that 6 hours. But then once you've given information back to us, our timeline picks right back up. So we really do want to be able to keep ourselves to our original timeline. So you don't have to start over. In the previous system, it displayed a very long list of names that had been submitted. And this included patients who'd already been discharged. Will Telegen periodically purge the list, or can we? Once a member has been created in our system, they live in our system. They may be used for other things down the future. And we always like to keep a historical record of all PASRRs. So I'm not sure what you mean by purge, because we do believe in data integrity. And if we've created something, we're gonna keep it there for us to be able to reference at a later time. Yes.
Hang on one second. So there was a list of patients who were essentially pending, right? So they discharged from the they were often the patients who ended up discharging from the hospital to a different discharge plan. So there was just this really long pending list of patients who never got cleared out because their reviews were never completed. And so it was not efficient or effective from a visual standpoint to identify patients we were actively working on. But placing tickets to have them removed was tedious and not always effective.
Sure. Yeah, we won't be doing that. So you'll only have cases pending if they're pending. And like I said, all of ours are going to be closed within 5 to 10 business days and closed. So you won't see those on your task list anymore. And so when we cover the training next week, when we actually dive into the level 1, hopefully you'll be able to see that a little bit better too. But you're not going to have kind of tasks hanging out there like that. So yeah, we'll cover that too. But that sounds like it'll be very different. You won't have that. So you'll only see the ones where you either have an RFI or that are pending and haven't gotten an outcome yet. Okay. Will we need to have a video capabilities for doing the virtual level 2s? We will talk about that. We're willing to work with you on what your technology has at your hospital. But again, a face-to-face is part of the purpose of PASRR, right? It's to be able to lay eyes on another human being and hear about how they're doing from them directly. So that's kind of an important part of the process for us. So we will definitely talk about that if you feel you've got some issues there. And it is exactly 11:30. There is two questions left. Oh, Melanie B, thank you for your response. Then there's what about, we would be interested in the outcome discussions. Okay, yeah, we'll keep that going for everybody. I want to thank you all for your time. Thank you, Stephanie, for sharing about Qualitrack, giving people a first opportunity to see this. And then I'll just put up here, thank you, Stephanie, for putting it up. Reminder of why we're doing this. PASRR is person-centered. So that is why we're doing this. And we want to keep it relevant. So thanks. I'll leave folks with those last two things on that last slide, Stephanie. Think about what was your big takeaway today? What did you get out of attending this training that you did not have before coming in? For good, for bad, like what's information that's going to be kicking around in your head? Feel free to talk to us about it later. What, if anything, will you do differently as a result of having spent your time with us today? But I thank you all for the hour. Thank you all very much. We will talk with you all soon. See you next week. Bye.
Thank you.